All right, so we had a client who with a senior citizen pet who called on the phone and said, my dog's abdomen seems bloated. And our front desk did an awesome job and said, that sounds like a problem, you should come in right away. So thank you for that. And this senior citizen pooch who weighed about 80 pounds had an abdomen that was big and distended. And when you put your hand on one side and tapped on this side, you could feel fluid, a wave of fluid, go from your fingertips and hit the other hand on the other side. And so while this dog did have a distended abdomen, it was not what we would call a classic bloat. Because when we use the term bloat, we're usually talking about a stomach that is distended with gas. And that's a little different. That's definitely located under the ribs on the side, and when you tap on that, it sounds, classically, it sounds like an overinflated basketball. So it's big and firm and hard and it pings, which is different than a squishy belly that has fluid, okay? But clearly the abdomen was distended, and this is a senior citizen pooch who had pale gums, not good refill time, hadn't been eating for a couple days, and had been coughing for 1 day, coughing/gagging for 1 day. And so initially on the phone, the staff wasn't sure if that was an attempt to vomit, which would go with a gastric bloat, or something else. Well, as it turns out, it was something else. As we examined this little girl, not only was her abdomen distended and she's pale, but she was kind of weak. She just didn't have much energy. So we started our diagnostics by doing some x-rays as well as running some blood work. The x-rays up here show, it's hard to see much because that's a lot of fluid in the abdomen. Normally, of course, you can see the outside surface of the stomach and the spleen. In this case, it just looked like one gray gamish because free fluid does that. It erases the lines between the different organs. We also ran blood work and found that her white blood cell count was normal. Her red blood cell count was fine. She was not anemic. So even though she was pale, it was not because of lack of red blood cells, it was because of poor circulation. We also found that her kidney and liver values were essentially normal, a mild change in some of her liver values, but not dramatic, and that her protein, specifically her albumin, was normal, and that's important as we keep going with this story. Seeing this fluid-filled abdomen, used our ultrasound and found, hopefully we saved the ultrasound images in the computer yet, but we found, of course, lots of fluid. In this case, the spleen was normal. You might guess in a senior citizen dog with a fluid-filled abdomen who's pale that perhaps she had a mass in her spleen that was bleeding. That would be super common. That was not the case. This dog's spleen was normal. The liver was mottled. It didn't have the normal architecture. It had splotches inside of it. And when we did a needle aspirate of the fluid, it came out as a clear fluid, not blood. Okay. We then looked at our chest x-rays and saw that her, you have the chest films? Yaga? We saw that her heart shadow was enormous, much bigger than it should be, and it was very round. It didn't have the normal contours of a normal heart shadow, and she had infiltrates in her lungs. And she had fluid around her lungs between, look how big her heart is there, between her lung lobes. So she had fluid in her abdomen, she had fluid in her chest, she had splotches in her liver, splotches in her lungs, and she had a really big round heart. So then we took the ultrasound probe and we put it on that really big heart, and we found that the heart was inside the pericardium, and the pericardium was full of fluid. So this dog had a pericardial effusion. Normally, the space between the heart and the pericardium is tiny, and it's just a little tiny bit of fluid that kind of lubricates. Well, this was full of fluid, such that the heart was being squished inside its own pericardium. So her heart was contracting, but when it relaxed, it didn't fill with blood because her relaxed heart was still being squashed from the outside. And so, if you connect the dots, pericardial effusion is most often from a heart-based tumor. Heart-based tumors can end up going to the liver. regardless of the cause of the pericardial effusion, that fluid squishing her heart was causing poor circulation, which was likely the cause for the fluid in her abdomen, ascites, from heart failure. Now, the alternative explanation is cancer in her liver that was weeping fluid into her abdomen directly. There's no good news in this story. So we presented the owner with the options, which if we were going to move forward would require pericardial centesis, meaning sticking a needle ever so carefully through the ribs, past the lungs, into the space inside the pericardium but not into the heart, thank you very much, to drain the fluid so that she could circulate and feel better while we figured out, is it really a heart-based tumor or is it really cancer in her abdomen, which could be done with more testing. But given the dog's age and the owner's wishes, we decided that we wouldn't pursue further testing, and we put her down. And I think that was a good decision for her. So a sad outcome, but an interesting turn of events, because the thing that you would expect, mass on the spleen, big belly, bleeding internally, was not at all what was going on with this girl. It was actually quite different.